תודה רבה. אני מדבר קצת עברית. הייתי סטאז'ר פה ב-75 בתל השומר, אבל שכחתי הרבה. אז אני אמשיך באנגלית. סליחה. So it's a big pleasure to be here. I always really love to be in Israel. And I noticed the title of the kenes has mumchim, and you know the definition of a mumche, huh? You know? It's someone who comes from out of town with all his slides. So I am so I have that qualification at least.
Has slides will come.
Yeah, I need to.
I think I will sit here so I can see the slides.
So thank you for coming to this workshop, because we have an expression, the neglect of neglect. That for many years we know this is such an important topic, and actually in 1984 there was a paper already, Isabel Wallach and Horowitz wrote on the neglect of neglect. And then 10 years later I wrote on neglecting the neglect of neglect. So it's, it continues to not evoke the same interest and response from, certainly from the media, you know, who much prefer the dramatic sexual abuse, but even from professionals. It's very often in the United States and around the world, you go to conferences and there's not so much interest in this topic. So what I want to begin with is quite briefly make the case for why this is so important. And I realize you came here, so maybe you don't need this, but so why is it so important? So some of the reasons: it is quite common. And I'm going to give you some of the data from the US, but here you see in the United States we have about 75 million children. You see that about 750,000 substantiated cases. So these are cases that got reported, investigated, and then there was enough evidence to say that these kids were abused and neglected. And you see the picture, which has been steady for many years, that 78% or so of what we are dealing with is neglect compared to, for example, sexual abuse, which is, I don't want to say unimportant, but 9%, physical abuse 18%. And just to give you an idea that this is not just, of course, the United States, this is one study done looking at university students in about 22 countries. I'm showing just some of them here. And you see that in all of these countries, the university students are reporting between 10 to as many as 36-37% that they were neglected. And then, of course, you think this is a privileged group. So coming back to Vered's comments, it's linked to poverty, how that rate would actually increase. And then the study that just you heard about from Tzvi and Rachel, looking at the epidemiology in Israel, and here the study of over 10,000 kids, and 18% reporting that they were physically neglected, about the same, emotionally neglected, and 10%, 1 in 10 Israeli kids, reporting that they had witnessed domestic violence, which arguably is a form of neglect. If you think that for kids, the home, it is so important that this be a safe, secure, loving place, and yet to experience the fear of your parents fighting, what impact that has can be construed as a form of neglect. So it's also important because of the morbidity and mortality. And for those who are not in medicine, morbidity are all the bad things short of death. And so the next slide summarizes many studies looking at the short and the long-term effect of neglect. Some of these, by the way, show the damage to be as bad as from abuse. And so we have found how neglect hurts the emotional, the physical health of kids, and also the cognitive and social development. just to give you an idea, when we look in the US at studies of adult criminals or juvenile delinquents, we see how disproportionately many of them were neglected. I'm a pediatrician, I guess I didn't say that, and so sometimes we see kids like this who are undernourished. And also important, because this is just one example of somewhat recent research showing in this case how these neglected babies had their corpus callosum. It's a very important structure in the middle of our brains that links the one side to the other, and it was smaller, perhaps with lifelong implications for their functioning. Here you see fatalities due to abuse and neglect, and of course some cases can involve both abuse and neglect. How do you think children die from neglect usually? Someone brave.
Nourishment?
Accident.
It's mostly accidents, Ken. So in the US, I work in Baltimore, and typically in the winter, there are some young kids, they are left home alone, there is a fire, and maybe 2 or 3 of those kids may die. And drownings, kids who are not supervised at the beach, in lakes, for example. So lapses in supervision, okay? And just to give you another example of the impact of neglect, this is an interesting study done on about 17,000 people in Southern California. And these were adults getting their health care through a certain plan. So they had a lot of information about their health status. And they asked them questions about what they called adverse bad childhood experiences. And you see them listed on the left. And then they linked that data to outcomes 40, 50, 60 years later. And this is one of perhaps 70 papers out of this study showing how having more of these adverse childhood experiences, including neglect, was associated with an increased risk of heart disease. Certainly for mental health problems, and also for a bunch of physical problems, including cancers. So more reasons why neglect seems to be so important. I imagine that all of us in this room, in our professional capacity, maybe not just professional capacities, have opportunities to recognize and intervene, and arguably, if you have that chance, there's a responsibility to try and help. So, there's also the cost, okay? And I was saying yesterday in Xifa that this is the language that talks most powerfully to some. We can talk about the rest, but it's the money in the United States.
And there are no shekels.
Yeah, I need to get some shekels in there. But it's, we are paying a huge price when you think of all those bad outcomes, whether it's in the learning or the justice system, the investigations. The cost is huge. And of course, what can I say? We are not so smart, and we are paying a lot of money after the fact. And then perhaps most compelling, and something that we often don't talk about at such meetings, is what I think is perhaps the strongest argument, and it's a moral one, that kids really, really suffer from abuse and from neglect. And so this gives us an impetus, I hope, to try and prevent or stop kids from being neglected. How should we define neglect? So even within the hospital where I work, we don't all agree. There's some differences in opinion, and this has been a big problem in the field of neglect because it's not quite perhaps as easy as other forms of abuse. But the definition is actually very, very important. It's not just some academic exercise as we sit here. because how you define it really shapes what you do when you see this kid, when you see that family, how you think about it and respond. So here you see the World Health Organization definition, and this is typical of what many countries have, certainly in the US, focused on omissions in care by parents or caregivers. We say back home, when parents mess up, they don't provide for what kids need, health, education, etc. Interesting, coming back to your point about poverty, it makes an exclusion for poverty, and it says in the context where resources are reasonably available. So, and hopefully in the discussion we'll have some time to come back to that. And then we are focused or prioritizing those problems that lead either to harm or to the high probability of harm. So let me ask you, what do you think? Why is the potential for harm important? Or do you think it is important? Should we limit our work to the kids who are already harmed?
For prevention.
Yeah, I think for prevention it would be a little sad or very sad if we waited until something horrible has happened, okay? And so if we have any interest in preventing that harm, then we recognize that those situations that are dangerous or have the potential deserve intervention as well. So I think it's an important concept both in law and in practice. Okay. So that's the frame that most child welfare has in many countries. But I want, just for maybe this hour, to ask you to take a few steps back and ask, why are we even having this discussion? What is our goal in defining neglect? And I want to suggest that our main interest is in protecting children and improving their well-being, and that it's not primarily about blaming parents. I don't know, maybe I am stubbornly naive, but after all these 30-some years working in this field, I actually do think that most parents want things to be okay or good for their kids, and that we have had a somewhat simplistic frame blaming conveniently parents, because it's quite easy to do that. So, if you're on the same page as me, someone should nod their head, yeah? Toda rabah. Occasionally it helps, that we instead can look at this problem, instead of blaming the parent, from the kid's perspective, a child-centered or focused view, and define neglect instead as occurring when a child's basic need or right is not properly met. That by itself constitutes neglect. I'll come to it in a moment. Of course, there are many reasons why that may happen, but if I, as a pediatrician, have in front of me a kid whose health care is not happening, that child, in my view, experiences neglect. And my job is to try and clarify what's cooking, what's going on, and how to help. And we could have perhaps an interesting discussion of, okay, what are these basic needs of children? It's a good, maybe for some hours. I'm going to guess that after a couple of hours, we would probably agree that what you see at the bottom here is what kids in Israel or everywhere actually need. These are basic things. We're not talking about luxuries. In the States, we would say a trip to Disneyland or the latest sneakers or cell phone. What would you say in Israel? The same. Okay. Not, I don't know, a lot or something. Okay. I'm going to cut that for... So what are some of the advantages of having this child-focused and rather broad definition? For one, it moves us beyond the narrow focus of simply looking narrowly at parents to think about why else are children being neglected? What else is contributing? And from that, it leads us down a path to think about other strategies and interventions that may help. Most importantly, I think it offers us a more constructive approach to this problem rather than the usual blaming. So if I can turn to the parent I just gave the example of and say, not you messed up, you bad parent, yeah? And sometimes I see doctors almost doing this, more or less, maybe with their voice. Instead, I can say, this is what your kid needs. How can we make sure that she gets the medicine? It's a very, very different approach. And I think it fits beautifully with our interest in kids' health, their development, their safety. This is one of my heroes, David Gill, who's one of the first researchers starting in the 60s. And David wrote about societal neglect. And I think, can everyone read this? Mm-hmm. Then I won't read it for you. But here you see that he's thinking not just of what parents or individuals do, but how as systems or institutions or a whole society can be neglectful. And it comes back to the issue of poverty. So in the United States, where we have 1 in 5 kids living in poverty.
It's 1 in 3.
Yeah, we're higher in 1.
You are higher.
Well,
but
depends
still,
how you count it. You count it very
How you
differently.
define the poverty?
In your way,
the important point is there are far, far, far too many. That's the problem. We can quibble about the numbers, but there are way too many. And for a rich country like the United States, it's an especial shame, I think. Let me save that for later. And here you see, Israel has actually signed the Convention on the Rights of the Child, and this convention actually says it quite clearly how government has this responsibility to protect and help families in taking care of children. Normally I would stop and ask any questions, but I've got to just keep going.
Keep going.
Keep going. Okay. Sorry, I'll lose my time. Okay. So there are many different ways that neglect can manifest, and this is what makes it challenging. These are just some examples here. So as a physician, pediatrician, I see inadequate health care. So children where the family are not sticking to the treatment plan, where a kid, for example, with bad asthma, who needs the medicines, but is back in the intensive care unit because they didn't fill the prescription. Of course, there can be many reasons why that prescription wasn't filled. Back home, it may be they didn't have the money to buy the medicine. I think Israel does a bit better in that respect. Dental care is a big problem. Mental health care. So even though I live in Maryland, which is a pretty good state in many respects, it's a quite rich state, it's not Mississippi, which is really bad. Even in Maryland, to find therapists, mental health therapists for kids, is very difficult once you go outside of the cities. Inadequate physical care, not having enough food and babies not growing well. So national surveys, for example, showing in the United States, 1 in 7, more or less, families reporting how in the last month, at some point, there was not enough food, just for example. And interestingly, if we had much more time, we have a related problem of obesity and how that raises questions sometimes of neglect. I mentioned earlier inadequate supervision. And perhaps most challenging, but also most important, is the concern about inadequate emotional care. It's most challenging because from a practical standpoint, how do you set that limit? How do you say, this is not enough affection? We all need, not just kids, right? We need that affection, those hugs, that love. And for kids, of course, this is critical. And when that is in short supply, this perhaps is the most damaging.
I love you, Howard.
Thank you. Feel better. Also, to complicate life, of course, kids are developing and changing, and so definitions will vary, or the situations will vary. A 2-month-old is very different, obviously, from a two-year-old, from a 12-year-old. And so we need to take into account the kid's age, development, mental health, physical health. So if I have a healthy 8-year-old who is home alone after school because both parents are working, it's maybe not good, but it might not be terrible. But if I have a kid who is setting fires, that's a bad idea, right? So these issues have to be factored into our thinking, the specific characteristics of a child. Also interesting is as we learn more about kids and childhood, there have been new forms of neglect. So I remember not that long ago where if someone smoking next to you was perhaps irritating, now we have learned the impact of second-hand and actually third-hand smoke, and especially if you have a kid with underlying lung disease, how that can trigger the asthma. This can be construed as a form of neglect if you have a bad asthmatic. We have a crazy problem I probably shouldn't get into about access to loaded guns. In the US, it's a huge problem, and about 20 states now have interestingly passed laws that if a kid gets a gun, and usually it's only uncovered when some tragedy happens, that the person who owned that gun can be held criminally responsible because it is their job in about 20 states to make sure that it's out of reach, out of sight, locked away. Domestic violence, I touched on this earlier, but we have learned a lot in the last few decades on how exposure to domestic violence is so damaging to children, again, can be construed as a form of neglect. How do we assess whether a need is adequately met? I said this is a problem with love and affection. It's actually a problem across the board. As a physician, I can tell you, we have debates about exactly how much vitamin B a child needs. It's actually not that easy to determine. And so it's especially complicated because what we're talking about naturally falls on a continuum. So on the left, you see where the child's needs are fully, beautifully met. On the right, you see where the needs are not met at all. But I think, as probably many of you know, we are often stuck in the proverbial gray zone, somewhere in the middle, where it's not a total disaster, and we're struggling with, is this neglect? The situation is not quite so good. And it's often, frankly, pretty arbitrary where people draw the line and label it as neglect. But I think the important point, the bottom line here, is in our clinical work, even when we have situations that maybe don't rise to the level that you would label it as neglect, or situations where I would report it to the child welfare, it doesn't mean that I can't do things. And many of these situations cry out for some intervention aside from the official reporting. So the question often comes up, is intentionality important? What do you think? It's important?
it's relevant, but it's not the only important thing.
Uh-huh.
It can be without intention, but it can still be potentially harmful behavior.
Okay, so again, if we had the afternoon, we could have a great discussion. But I want to suggest, just to be brief here, that from a practical standpoint, I think it's not a useful concept. First of all, coming back to what I said a few moments ago, I'm sticking to the idea that most parents, do not intend to neglect, do not intend to harm their child. In fact, they have good intentions, but stuff gets in their way and impairs their ability to be a good parent. But from a practical standpoint, unless someone actually tells you, yes, I meant to starve him, yes, I meant to not give him the medicine so that he would get sick, which of course seldom happens, it's very difficult to measure. And just one last thought about intentionality. There often is already among professionals some, maybe it's a bit strong a word, but hostility towards parents who are neglecting their children. Why are you a bad parent? Maybe we don't say it quite in those words. If you think that that parent did so intentionally, it can aggravate that negative feeling and of course be conveyed and of course jeopardize our work in trying to help that family. So I'm going to stick my neck out and say that it's better to mostly think, most of the time, that it's not intentional. So how should we consider the role of different cultural values in considering neglect? And this is important, obviously, in Israel, but actually everywhere. I work on the west side of Baltimore, and I'm this white guy, male, professional, older, and I work largely with very poor, black, often young, single mothers. And I have to be careful. Am I imposing my ideas of how kids should be raised on them? I think, maybe I grew up where the family had supper every night at 6:30. We didn't, by the way. And this is what's right. So what does the research show? Again, just very briefly, we and others have studied this, certainly in the US, and find, surprisingly, that there actually is a lot of agreement. Not totally, but a lot of agreement among people from different racial groups, from socioeconomic status, about what's important for children. The other bit of evidence I would point to is, again, the UN Convention on the Rights of the Child. Is everyone familiar with it? Terrific, boy. Not like back home.
United States.
Spare me though. But if you think about it, this is a remarkable achievement. That this is a wonderful blueprint of what a decent society would do for children, and yet countries as different as Botswana to Brazil to Belgium have signed this document. And so I think it's evidence of a lot of agreement, but there are some differences in different countries, and here you see one.
Yeah, I wouldn't do that.
So
Were you pet?
here we say the 64,000 shekel question. Yeah, I don't know. Maybe with inflation it's a bit more, I don't know. But the big question is, why are kids neglected? How much time do I have?
I don't know, 10
All day
minutes,
long.
10 minutes.
something like that.
Okay.
We'll give
I
time
can
to-
solve all the problems.
So this is the big question, isn't it? Because we think of parents, I've said, love their children. We have rhetoric, we have poetry. We talk about children are our nation's most valuable resource. And yet we have this problem which is so prevalent. What's going on here? And so I think for one important point I want to make is, to use a medical metaphor, it's useful to think of neglect as the symptom. Someone has a headache, whatever. the real question is why, what is underpinning, what is the cause of that? Because that is our job to understand. When we understand that, it guides how we respond. What's the appropriate intervention? And maybe this is, I'm guessing, a familiar model, that we have learned something in the last 50 plus years, that it's not simply a matter of bad parents who don't give a damn, but that in fact at each of these different levels there may be factors contributing to this problem. And so at the individual level there can be characteristics of the child. So we don't often think about that, but for example, I might have a teenager with diabetes, and a teen who wants to be beautiful and perfect and is in denial of her diabetes. And her parents might be doing everything possible to make sure that she eats the right food and gets her insulin, and yet she's back in the hospital because the kid sees it differently. It's just one illustration of how kids might contribute. Let me be clear, not for a moment is this to blame that kid, but it's important to help us understand the source of that problem. Clearly at the family level there can be issues, at the community level. And you'll see at the bottom here I have professional response. So how do you think, I don't know everyone in the audience, but I'm guessing most are professionals, how do we contribute to kids being neglected? Do we? Do you think, is this a weird suggestion?
Well, many professionals here will complain they don't have enough resources to respond to all the families that they need their care. So in that sense.
So there are many ways that can contribute.
It depends who is the kid and from which group in the society this comes from. It's very different from a Jewish kid in Tel Aviv than a Bedouin Arab kid in an unrecognized village in Israel. So you have to look at the community and the way we treat children from different origins.
So these are some examples. There are many. There are many different ways. Sometimes it's a lack of skill. So for example, I teach pediatricians how to respond if a mother is abusing drugs or appears to be depressed. But I can tell you, most of the time, what happens back home is if a physician encounters a parent and he thinks maybe this parent is high or stinking of booze, and he doesn't really know how to approach that situation. He hasn't been trained, perhaps, to be fair. It's an awkward conversation, and very often they'll do nothing. So it's just one illustration of how as professionals we have these opportunities, and yet for a variety of reasons we may not do a very good job. And then of course at the societal level, and as Vered pointed out, how poverty is one big example. Lack of family-friendly policies. So the United States, which I know best, does a really bad job in this regard. And so even though we finally, for example, have parental leave, that mothers and fathers can take leave after a new baby, but it's unpaid. And so for a lot of families, that's nice, but from a practical standpoint, they really can't take off from work.
In Finland, it's 9 months paid.
We can dream. Not too old to dream. I just want to touch a little bit on poverty and child neglect. And again, here you see some of the data from the US, where this is looking at families identified as neglected, and how when they looked at the lowest income families, the rate was 7 times higher than in any other socioeconomic group. And here's the important point. Even though today is focused on child abuse and neglect, we know very well that on all kinds of childhood outcomes, poverty is the strongest predictor of lousy outcomes. If I have a little premature baby in the hospital who weighs a pound, half a kilo, okay, and I'm thinking, how is this baby going to turn out? The most important predictor is the social class of that family. If that family is middle class, I can be cautiously optimistic. If they are into a situation in poverty, I cannot be optimistic. Okay, I should wrap up. So the big daunting question of what should we do about neglect? Maybe you're wondering, why does he have that picture? Why? Think about it. I'll tell you later.
What can I do about this?
So, a few closing thoughts. I think, for one, I hope, if you weren't already persuaded, that we recognize the seriousness of neglect. Even though the word doesn't evoke the same repugnance, the same response as abuse does, this is not a benign problem. It actually is quite serious. I hope that you'll also consider the advantages of approaching this from the perspective of the child-centered view as a shift from instead blaming parents. I think not a small difference. We don't have time, but I think what's so important is that we pay more attention to strategies at all levels of how we can do better to prevent this problem. So much of what we do in many countries is too little and too late. And again, if we would get smarter of what could we do earlier on to prevent abuse and neglect. And if you think about it, really what we are doing is we are, in these kinds of policies and programs, really promoting children's good health, development, and safety. So if we were wiser in this respect, the fruit, the dividends of our efforts would even be far richer than preventing neglect and or abuse. But in many ways, kids and all of us would benefit. I don't know if you guys get the PowerPoint, but this is just one slide showing a model that we've been working on for the last 15 or so years in primary care pediatrics. So a little bit analogous to Tipat Halav here, and an effort to, as I suggested, identify problems, the parent who may be depressed, and help them get help. And so doing, strengthen the family, support the parents, and thereby promote children's health, development, and safety. Okay, I think I should, I need to end, I think, right? Last few slides. So, in responding to neglect, very often, for the most part, we have relied on the child welfare system, and there is an interesting, I think, good development in the US, and that is many of us, including those in child welfare, have recognized that the system often does not do a very good job. And how, for many of these families, often for neglect and sometimes the less severe physical abuse, we can, instead of investigating who is to blame, have a different approach. Instead, evaluating what a family needs, and through community services or resources, helping them. And this, I think, for many of us, is at the heart of this work. I think it's why we are in this field, why we are here today. And so for many neglect situations, this, I think, will be a better approach. Treatment can help. Sometimes I hear, particularly from child welfare workers, there are so many problems. It is so bad. They say, neglect are our worst cases. Give me a physical abuse case. I know what to do. Do you recognize this baby?
That's the one you showed.
Yeah, very good.
Who is that?
It's the baby I showed you earlier on who was badly malnourished, and this is just one example. But to illustrate the point, I want to just mention some of the data that has come out of studies of the Romanian orphans. And you'll remember about 20 or so years ago, these kids who were rescued from those terrible orphanages in Romania. And this is studies by Rutter and others. This is one showing about 100 kids who were brought to the UK and adopted, some of them very early, under 6 months, and some were a bit older. And they found again that the ones adopted as little babies, under 6 months, actually had normal cognitive development, and those adopted later, not quite so good. So this, I think, points to sometimes the remarkable resilience, because this was the most severe neglect, right? These were kids who were sort of warehoused in those orphanages, and yet we see how some of those kids were resilient. But it also illustrates how resilience is a relative concept, and how not all of these kids escaped unscathed. It also points to the importance of that early period. And so those first 6 months seems to have made a big difference. Okay. Trickle down. A trickle-down approach is not enough. So sometimes we see in our strategies, if I help the parents, the kids will benefit. And there is a truth to that. But the point I want to make is that we also recognize what these kids have experienced and the special needs that they may have, and not only rely on working with the parents and ignoring what the children as well may need. I'll skip that. And then I think the last point is how all of us in different ways can be, should be, feisty advocates. This is a good fight for this lifetime and the next, right? It's a good fight that we are fighting at all of these different levels. So as a pediatrician, for example, sometimes I'm explaining to a parent, you know, it's okay to pick up your baby who's crying, and you don't have to worry about spoiling him. He's 4 months old. He needs you to please pick him up. It's going to be all right. Sometimes we advocate for parents. When we help a depressed parent get treatment, that's a form of advocacy. Family, when we think at the father level, how do we engage dads? I think maybe less of a problem in Israel, but back home, this is a big issue. Fathers are important, right, Rami?
I hope so.
We hope so. I deeply believe so. So how do we do better at engaging men to be involved in their kids' lives? Obviously, many, many benefits. And then this good fight also involves what do we do at the community level and at the broader societal level and with other professionals. You know, how do we help our colleagues, train them to improve the response to these problems? So, last slide. Is one thing more important than knowledge?
More knowledge.
Care.
More knowledge.
More knowledge.
Care.
Care.
Moral.
Money. Joel, what do you say?
Commitment.
Imagination.
Okay, toda rabah.